Hey, and welcome to Medibles, where I talk about medicine, mindset, wellness, and so much more. I hope you stick around with me and learn something new today. Now let's take it to the whiteboard, where I will discuss generalized anxiety disorder and its causes, symptoms, diagnosis, and treatment. Generalized anxiety disorder, also known as GAD, refers to excessive worry about different spheres of life. This can involve personal relationships, health, school, or work, just to name a few. Everyone worries from time to time, however, the issue arises when the anxiety interferes with daily functioning, results in physical manifestations, or affects interpersonal relationships. Generalized anxiety disorder is part of a group of conditions known as anxiety disorders. Some of the other mental health conditions that make up anxiety disorders include panic disorder, specific phobias, social anxiety disorder, and PTSD. Approximately 40 million Americans suffer from an anxiety disorder, and 6.8 million of those adults suffer from generalized anxiety disorder in particular, which makes up roughly 3% of the population in the United States. There is also a higher prevalence of GAD among females compared to males. Although there isn't one exact known cause of GAD, it seems that genetics and environmental factors both play a role in the development of the condition. According to one article, which I will link below, the heritability of GAD was determined to be approximately 30% and has an association with other anxiety disorders and mental health conditions. Dysregulation of the neurotransmitter GABA seems to also play a role in the development of GAD. GABA is naturally an inhibitory neurotransmitter, so the suppression of GABA is thought to increase amygdala activity and volume, resulting in anxiety symptoms. There are two components when it comes to GAD symptoms, the psychological component and the physical component. One of the most common presenting symptoms is a sense of restlessness and feeling on edge, similar to a feeling you get when you are waiting to get back important test results. However, in patients with GAD, these symptoms are usually amplified and come on suddenly for no particular reason. Patients with GAD may logically understand that these symptoms should not be present, and may not even have a reason for the particular symptoms, but they have no control over what they are feeling. Patients with GAD may also find themselves easily irritated by situations or people around them. The persistence of symptoms can result in difficulty concentrating on work or school because of the recurring thoughts around worrying about different events. It can also result in the disruption of sleeping patterns and difficulty falling asleep at night. The psychological symptoms can then translate into physical symptoms such as shoulder and neck pain because of excessive muscle tension. This can also result in headaches. Some other physical manifestations that are sometimes seen include tachycardia, which is an increase in heart rate, sweating, shortness of breath, or lightheadedness. These physical symptoms are also seen in those who suffer from other anxiety disorders I mentioned previously. Hey, your friendly neighborhood doc, just checking in. If you feel that you may be experiencing any of the symptoms described in today's video, please speak with your doctor or a licensed mental health professional. According to the DSM-5, generalized anxiety disorder diagnosis involves excessive worry about different areas in a patient's life that has been present for at least 6 months. Patients must also exhibit at least 3 of the symptoms I mentioned previously. As I have mentioned in previous videos, it is important to rule out any other health conditions, medications, or substances that can be causing the underlying symptoms seen in generalized anxiety disorder. For example, hyperthyroidism can result in palpitations and similar physical symptoms seen in GAD. Therefore, it is extremely important for the diagnosis and ensures there are no underlying health conditions, and that the physician isn't missing something that can be causing the symptoms. The treatment for GAD involves a combination of psychotherapy and medications. If you remember, in the previous video I made on depression, I spoke about how SSRIs are commonly used. For generalized anxiety disorder, SSRIs and SNRIs are also used as a first-line medication. If you also remember from that lecture, I mentioned that SSRIs and SNRIs may take a couple of weeks before the effects are felt from the medication. Benzodiazepines are also sometimes used for the treatment of GAD, however, due to the potential for addiction, they are typically reserved for short-term use or in acute settings rather than a form of long-term treatment. Buspirone is another medication that can be used in the treatment of GAD. However, just like with SSRIs, it may take several weeks before the effects of the medication are felt. Psychotherapy, particularly CBT, has proven to be extremely beneficial for patients with GAD. In addition to psychotherapy and medical treatment, creating healthy habits may help manage anxiety symptoms, whether it's exercising, reducing intake of drugs and alcohol, or using meditation techniques. That's all from me today, but if you're enjoying this type of educational content, be sure to like, comment, and subscribe to stay tuned for much more to come. If you have suggestions on what you would like to see next, drop them down below in the comments, and I'll try to make a video on it. Here is another video I thought you might like and my latest upload in case you missed it. Until next time. Bye.